Welcome to another episode of DentalFlix Uncut. I am so excited to introduce you to our creator today, Ann Marie DePalma. Welcome to the podcast, Ann.
Thank you, Allison. It's great to be here.
It's great to have you, especially after I got to spend some time with you a couple months ago now, recording your course live. And truly, I've like not stopped raving about it since, honestly. I think you've heard me probably like 100 times say how impressed and how excited I was about listening to your zone of genius, listening to how you help the industry. So why don't you share that with our audience today? How do you help our industry? What do you do?
So my background, let me give you a little bit of a background. Thank you, Allison. It's I'm out here in Boston, right outside of Boston. It's a beautiful, almost summer day here, or actually it is summer now. And my background as a hygienist has led me down a different path. So yes, I worked clinically for a number of years in perio and in general practices. But from there, I worked as a trainer, software trainer, and a consultant and coach and educator. So I've had a variety of pathways in dentistry and dental hygiene, as well as being a writer for a number of different publications over the years and doing a lot more continuing education programs now. And as a result of doing all of those continuing education programs, the way I got started was actually the program that we created through DentalFlix, which is TMJ TMD, exploring both sides of that. I'm actually a TMJ patient, TMD patient, have had a number of different treatments within the protocols. And as a result, when I was going through all of my issues and treatments, I couldn't find anything that, as a hygienist, I needed to know. So I started creating a program for dental professionals about TMJ, TMD, and presented that a number of different places, had a support group over the years, so have had a number of different things in that area. And over the years, from that initial program, I've developed a number of different programs, ranging from currently, the big topic in dentistry is AI and technology. So I do some of that. I have a program also on DentalFlix on mastering leadership and communication. So those two programs are on DentalFlix, the TMD and the mastering communication and leadership one. But beyond that, like I said, I've got AI and technology and practice management and implants and all sorts of diverse topics because as a hygienist, I need to know a lot of different areas when I'm treating my patients, when I'm working with my patients, as well as working with our teams. We have our team meetings. We should be educating our teams and part of those meetings.
100%. And I think having your wealth of knowledge and your experience inside of the education that you teach is so valuable. I always say when you're like a newer hygienist or if you're just getting started in any profession, finding people that can teach the core concepts of elevation in a really powerful or succinct or clear way is so helpful to your career. Like you can grow so fast by learning from those that have gone before us. But I want to dive deeper because you kind of mentioned that you were a TMJ, TMD patient, but I know your story a little bit deeper than that from listening to you speak. And something I'm noticing in our industry, it's sometimes the people that go through the pain and suffering of an experience that dive the deepest into the knowledge and the solution, like being your own advocate, being your own, person that's going to help solve it. So share a little bit more about why TMJ and TMD was such a important topic for you.
So, as I mentioned, when I was going through everything, I've had appliances, I've had physical therapy, I've had muscle injections, joint injections, all the way down into arthroscopic and open joint surgery. So I've had the entire range of most of the treatments that are available. Now, I haven't had Botox, and that's a whole nother issue. But as I mentioned, going through all of that, as a hygienist, if I couldn't find out the basic information. And what I was finding was either way above me or way below me. Now, I'm a smart person, but there were things there that I just couldn't understand.
Hmm.
So
Yeah.
if I was having difficulty with that, what about the average patient? What about the average person out there? So by educating other dental professionals, it opened up a whole realm of people and
Mhm.
helping those patients who are in TMJ, TMD treatment are actually chronic pain patients. They're going through all of the stages of chronic pain. So we need, as dental professionals, need to understand that and help guide them. We may not have the answers to their situation, but to help be there as a listening aid. And
Mhm.
that's what we should be doing with all of our patients, listening. We have
Oh my
two ears
gosh.
and one mouth for a reason.
I love that you said that some of the information is above or below you. And what do you do with that information? Like the real question I think needs to be answered in every single, scenario in a dental practice is like, what is my job with this? And with TMJ and TMD, sometimes I think dental hygienists are like, well, I don't really know. Or even clinicians are like, I don't really know what my job in is around this. And I know like being a clinical dental assistant and working in a practice for over a decade, sometimes those were the most challenging patients because like we didn't know how to help them, but there's still a role to play. So from a hygienist perspective, if they have a patient that comes into the practice and they do have TMJ, TMD symptoms, or they're explaining and expressing that they're having discomfort, like just give us a little bit of insight into what's the role of a dental hygienist.
So during the program, and that's a great question, Allison. And during the program, I go into what are the roles of the dental team. So whether you're the doctor, the hygienist, the assistant, or even the business team, the administrative team, they all need to understand what's going on with that patient. But as a hygienist, we're there to listen. How many times have patients come in and sat in my chair and said, things that you would never think of? We are the psychologists sometimes, you know. But as a clinical hygienist, having them use mouth props, using their own fist underneath their chin, using shorter or longer appointments depending upon what their particular needs are, maybe using pre-medication. One of the things that I have trouble with is as a hygienist, I know I need to have regular radiographs, but I have difficulty opening. So, how do they maneuver around my opening? Or if I need to have extensive dental work done, how does the restorative dentist, or I've had to have teeth extracted, how do they handle my situation? So,
Mhm. No, it's so important. And I think your point of needing to listen, I think sometimes those patients feel unheard. They feel like they're just completely at a loss for what to do and their pain is real. And so I think it's just so, so powerful. So if you could kind of go back in time as a dental hygienist and if you knew everything that you knew now, like Anne, for those that may not know Anne yet, is like on stages. She's speaking all over the country. She's educating teams all over the place. And so she's really kind of an advocate and a keystone of this information and knowledge. But if you could go back, Anne, and have all the information that you have in your brain now at the very beginning of your career, what would that have done for you as a dental hygienist?
so initially, when I was first practicing, I was practicing in a general practice that we saw 30-minute patients. And that kind of burned me out a little bit. So as a result, I started expanding and learning more. Now, you don't have to be burnt out to keep learning. Everything that we do in dentistry and dental hygiene, we need to be constantly learning. It's not just a
Mhm.
one and done. You graduate, you're done. Graduation is just the beginning. You're in your early career. Just keep learning. Go to CE courses, not for the sake of getting CEs,
Mhm.
but for the sake of learning. How many of the hygienists that I've come across take CE because they have to,
Yeah.
they have to achieve that. Don't be that kind of professional that just does that. Keep learning, keep exploring, look for mentors. Like you mentioned, there are so many of us out there that have walked the walk.
Yeah. And so if you could be that hygienist and like living in your shoes, like would you say you'd be less burnt out, more joyful, more engaged with your career, like knowing all the things that you know now?
Yeah, oh, definitely. Definitely. It has opened up a whole different world for me beyond just doing that clinical hygiene. This hygiene is so amazing. There's so many different paths that you can take. And I've learned from all of my experiences, I've learned something that I've taken to the next level, to the next position. So it's always growing, whether it's
Hmm.
been a good experience or a bad experience. I've had your career is never a straight line. You've got ebbs and flows.
It's 100% true. And something I talk about a lot as a professional coach is whose job is it to keep you inspired? And the reality is it's yours, like it's ours. It's individual role to keep yourself inspired in your career. And one of the best ways to do that is to keep learning. And you really don't even know how that knowledge or education is going to impact and affect your career in the future. Like you really, when you first started as a dental hygienist, I can imagine you didn't necessarily know all the things that you were going to be doing now, but it's like step by step, like learning by learning, education by education that's going to help you get there. So,
Exactly.
how do you feel AI is changing the dental hygiene profession?
It's engaging our patients.
Mm,
Patients believe in technology. They will come into your practice with X, Y, and Z from Dr. Google. Saw this on Dr. Google. What do you think? They believe technology before they believe us. So AI is going to make that technology and clinical interaction so much stronger. They're going to believe us now because technology has shown them that, yes, this is periodontal disease, or this is caries, or this is what we're doing with our periodontal charting. Just rattling off numbers, they may or may not get it. But when they see a physical chart and they see what their disease process is, they get a better understanding of how they can maintain, whether that be their health or creating health from their disease.
mm. Oh my gosh, I love that. I think that's so true. Patients trust technology. They really do. And it allows us to just have a different window to connect with them and in a way that they can understand better. So, what are some of like the AI like softwares or companies or anything that you have like seen and liked or you're like, "Ooh, I'm excited to see how this progresses."
I love all of the radiographic
Hmm.
imaging.
Yeah.
There's so many of them. There's four of them that I just recommend to all practices or all teams. Do your own research. We have Overjet, we have Videa Health, we have Denti AI, and we have Pearl. Those are the four big ones. Do
Hmm.
your research. Find out one may work for your office where another one may not. So
Hmm.
all of those. And then in terms of the periodontal charting, we've got Denti.ai and we've got Bola, both of which
Hmm.
are really great products. All of them are awesome products. But you have to find what's going to work best in your workflow for your team. There's other things that the administrative team can use, voice notes and call metrics. So there's so many different aspects of AI right now that's out there that we as a dental team, not just the clinical side, but the administrative side, can use to help our patients and to grow our practices. Yes, we want to help our patients, but dentistry is a business. So we
Hmm.
need to look at the metrics, and using AI helps with that too.
So good. I so agree with that. And something I think like I see a lot of with newer clinicians, even newer doctors sometimes is that you go into dentistry, to dental hygiene, to be a dentist, to take care of people. Like that's the reason why you choose the field because you like care, you deeply want to support and help others. But what you just said, like dentistry is a business. How did you adopt that mindset as a dental hygienist? Like what was one of the ways that you like really leaned into that and helped your career as a dental hygienist knowing that?
So throughout some of my clinical experiences, I just didn't sit in my operatory and eat bonbons, so to speak. I was learning about the practice. I was
Yes.
learning about how to, answer the phones or how to enter information into the software or do financials. So again, going back to that constant learning, whether that's within your practice or beyond, just learning about how the business of dentistry is. Yes, we want to help people. That's why I got into it. That's probably why you got into it. We have that helping mindset, but we also have to understand that it's a business and that
Mhm.
where our business mindset has to be.
Yes,
Now,
they
I'm
both
not
have to work
talking
together.
about Right. I'm not talking about not being on that production wheel, that hamster wheel all the time. But there's a saying, if you do the best for your patients, the money will follow.
Hmm.
So just being there and helping your patients get what they need, it was interesting. I found information a few years ago that the most requested item in the Depression was not food. People didn't, they needed food in the Great Depression. They needed food. They needed housing. They needed all sorts of different things that they weren't able to get. But there was one thing that they really wanted, and that one thing was lipstick. Think about that. The little tube of lipstick. People wanted that to make them feel good. So, helping our patients want what they need in dentistry helps promote the business of dentistry. It builds the value. It's not just a cleaning. In one of my programs, I talk about the power words and the negative words that we use with our patients
Hmm.
and how we can drive those words to help the patients get what they need.
Gosh, I love that. That's like just like genius. That's so genius. And I always say, like, being a dental hygienist is really, really powerful because it's the only healthcare profession that sees their patient so regularly. Like every 6 months, you have that patient coming in. And I know so many stories of dental hygienists like using their ears, using their kind of intuition or just like their relationship with the patient, seeing things that they help their patients with outside of like the scope of what was to be done that day, outside of the regular cleaning. And I think that's really the power of being a dental hygienist is that you're really helping people change their lives, be healthy long term. Like you are their biggest advocate. And so becoming the best dental hygienist you possibly can be just gives you even more power to help and change patients' lives. And some of these things are really like they're the nuanced things of learning how to communicate, learning the business of it, learning AI, like all of these things really add up to being a phenomenal clinician and team member. So, how do you specifically help? Like, do you have online courses inside of DentalFlix? How are the ways, like, what are the ways that you are specifically helping practices right now?
So beyond DentalFlix, which is amazing, there's so many good courses, not just my courses, but all the other courses as well. Um, Doing in-person CE programs, doing virtual programs, whether that be for groups or individuals, or training with offices, helping them develop some of their standard operating procedures, what they need to be doing to grow their practices, to help their patients. And I love that you just met what you were just talking about because that reminded me of a story. When I was in clinical practice, there was a woman who came in pretty regularly and she was a talker. She loved to communicate. She loved to tell me what was going on in her life. But then this one particular day, she came in and she was really quiet. I knew something wasn't right. So I sat her in the chair and we just talked. Come to find out, her son, who had an addiction, had relapsed. And she was trying to figure out ways of helping him and herself as well. So we discussed that. I never even touched an instrument that day. We just talked. And luckily, the periodontist I was with that particular day agreed. And he said, you did a great job by dealing with that. Yes, I lost production. Yes, I know that. But in the long run, she came back the following week or 2 weeks later, whatever it was, and thanked me. And that small little word, that thank you, helped promote other people to the practice. She was talking about us to other people. I didn't do my hygiene procedure. I just listened to her, which made all the difference in the world. Now, we can't all do that, but just listening to our patients in however way and manner that we choose.
Oh my gosh, it's so true. People don't care how much you know until they know how much you care. And that is the way that we get our patients to do the things that we want them to do for their own overall and oral health. And so it's just so deep. You have such a rich knowledge of the industry, the profession of dentistry, and of how to be just a fantastic clinician. So I just want to recommend everybody, please go into DentalFlix and watch Ann Marie's course. You will not regret it. She did such a phenomenal job recording it. You can learn so much from this incredible woman. And just remember, like the amount of experience she has, the amount of education she's taken, you can obtain that for yourself no matter where you are in your career. And I think that's just so important for us to continue learning, to continue serving our patients. And I just want to thank you for the work that you do in our industry, for just who you are, for the courses and the education and the lectures that you create for our industry. They're so valuable.
Thank you. And thank you for what you do. Your DentalFlix is amazing. Like I said, it's opening up worlds for team members that they never thought existed. So yes.
I love it. I absolutely love it. If somebody wants to contact you, how can they get a hold of you?
Two ways. Through my website, which is DePalma AnneMarie, or email me, AnneMarie DePalma @gmail.com.
Amazing. Everyone, go and take a look at her courses, get to know this amazing woman. Thank you for being a DentalFlix creator. Thank you for the work that you do for our industry. And we will see you on another episode of DentalFlix Uncut.
Thank you. Have a great day, everyone.
You've just unlocked valuable insights with DentalFlix Uncut. But there's more. DentalFlix is not just a podcast. It's a thriving community, a hub of knowledge, and the #1 online streaming CE platform in dentistry. With just a few clicks, you can start exploring a wealth of resources, including in-depth training on leadership, case acceptance, scheduling, hiring, weekly marketing calls, insightful gap assessments, and scorecards, all designed to help you master what you discovered today and propel you further on your path to dental excellence. Head to DentalFlix.com to get started for free and embark on your journey towards mastery. Thanks for tuning in to DentalFlix Uncut. See you next time.